Hello dear students, I am Professor Dr. Dharmendra Sharma. I am the Principal and the Head of Department of the Department of Forensic Medicine and Toxicology at the D.Y. Patil Homeopathic Medical College in Pune. Our lecture is about ethical dilemmas and consent. As we all know, dilemma means that you are in two minds, whether you go for this or you go for that. So, in the medical field, ethical dilemmas involving the consent are among the most challenging issues of healthcare professionals, usually what we face in our lives. The consent is the cornerstone of the patient autonomy, ensuring that the individuals have the right to make informed decisions about their medical care. However, this principle can be tested in complex situations where what a patient wants may conflict with what the healthcare providers believe is in the best interest of the patient. For example, a competent adult might refuse a life-saving procedure due to his personal beliefs, fear or mistrust of the medical system, placing the healthcare provider in a position where respecting this choice could result in harm or even death of the patient. Moreover, consent becomes even more complicated when dealing with patients who may not have the full decision making capacity, such as minors, individuals with cognitive impairments or those in a state of unconsciousness. In these cases, the ethical principle of beneficence, which obligates the providers to act in the best interest of the patient, often collides with the need to respect patient autonomy. For instance, the parents may refuse or recommend treatment for their child based on some religious or cultural beliefs, challenging the doctor to balance the patient's authority with the child's right to appropriate medical care. Additionally, cultural and societal factors can further complicate the consent. In some cultures, the patients may defer the decision making to family members, believing that it is their family's responsibility to make such decisions. This can create an ethical tension for the healthcare providers and the doctors, who must navigate respecting the cultural practices while ensuring that the patient's individual rights are not compromised. In emergency situations, these dilemmas further intensify when a patient is unable to provide consent due to their condition and immediate action is also needed. Healthcare providers and doctors often operate under the principle of implied consent, assuming that the patient would agree in life-saving measures if they were able to consent. So, doctors always think that if the patient if he would have been okay, he would have definitely given his consent. So, implied consent, they work on the principle of implied consent. However, this assumption can be ethically problematic if the patient has previously expressed specific wishes, such as refusing certain intervention based on religious beliefs or any other belief. Resolving such dilemmas requires a multifaceted approach